I'd like to extend a warm welcome to each and every one of you who have taken time to join this evening session Total Transformation Seminar. We truly appreciate you setting aside time to be week after week on Mondays to learn and to share wonderful thoughts and knowledge on various aspects of human life, especially in the context of the pandemic. This evening also we have an exciting topic is there, and the presenter is not a stranger to us. A couple of weeks ago he did a presentation for us, and he will be introduced shortly. A few reminders before I hand over the time to the moderator. I'd like you to keep your mics muted, and if you could on your video, we will truly appreciate. That will really be a good experience for the presenter, that he's able to communicate while he's able to see. Wherever possible, if you're in a comfortable place, if you're not driving, please do on your videos, and we truly appreciate your efforts. Please do keep your mobiles on silent, and making sure that your mic is also unmuted so that the program will run smoothly. The program is structured in a way that the presenter will have 15 minutes time to present on the particular topic, and then the moderator will be able to ask questions on behalf of you. So if you have any questions on this particular topic, the prostate cancer, be prepared for your questions. You could put them on the chat, and the moderator, Dr. Alfred, will be able to see the questions, and you will be able to ask the question to the presenter. Without any further delay, once again, a warm welcome to each and every one of you, and I hand over the time to Dr. Alfred.
Thank you very much, Pastor. Welcome, everyone. As has already been said, today's topic is about prostate cancer, and our speaker for today is Brother Leebert Hughes. He is a life counselor, but he is also a volunteer speaker who speaks and has done lots of talks on this subject on behalf of Prostate Cancer UK, which is a prostate cancer charity here in the United Kingdom. So the topic is prostate cancer, what men must know. And it's important. I'm glad that there are a lot of ladies as well present today, because where there's a man, there's also a woman. And a lot of our women also have got brothers, have got wives, have got, husbands, have got cousins and family members as well. So this topic is important for everyone. So I'll hand you over to Brother Hughes to make a beginning.
Good afternoon, everyone. As it says there, my name is Leebert Hughes. I am a volunteer speaker for Prostate Cancer UK, the largest charity looking after men's health and their family. So today we are looking at, I just want to do a brief overview of what you need to know regarding the prostate. Okay, what you need to know about the prostate. I'm so pleased to see so many women in the chat, because we use women as ambassadors. They are the ones that normally give the nudge to their husbands to go and see their GP. So we welcome you to this program this afternoon or this evening. Okay, so that's me, and a little bit about what I do.
All right, thank you very much, Leebert. Could you start then by speaking to us about what are the basic facts and figures of prostate cancer in the United Kingdom?
That's a very good question, because the figures I'm going to give to you are English stats. Okay, so it doesn't take in the other parts of the world, just English stats. And I don't want to frighten you by giving you the stats, but to help you to have an appreciation of how this disease is impacting on our men. So to answer your question, Alfred, we already know that prostate cancer is the most common cancer in men in the UK, and you could say across the world. If I were to tell you that over these figures are pre-COVID, so the figures will be much higher than they are right now. About 47,000 men will be diagnosed with prostate cancer. That's about 139 per year. I don't know if there's any City football fan on the chat, but if they tell me that City football ground capacity is 52,000. So we could fill the stadium every year with men that are diagnosed with prostate cancer. It's interesting that every 45 minutes, a man will die from prostate cancer. So we are losing about 11,500 men per year to this disease. Interesting that the figures are saying that 1 in 8 men will get prostate cancer in their lifetime. However, if you're a black man, it becomes 1 in 4 that will get prostate cancer in their lifetime. May come back to this figure a little later on. So in the UK, we have over 400,000 men that are living with and after prostate cancer. So prostate cancer is not a death sentence if it's caught early.
Sorry. All right, thank you very much. So what is the incidence, if you look at the ethnicity of people in United Kingdom, the men in United Kingdom?
Yes, that's quite interesting too when you look at these figures. When you look at a white male, you find that the incidence rate is 96, you might as well call it 100, to 99.9 per 100,000. So when we look at the Asian, we find that their incident rate drops or is lower. So they start at 28.7 to 60.6 per 100,000. The interesting fact is that when you look at a black male, it is significantly higher. So it ranges from 120.8 to 247.9 per 100,000. But that kind of reflects the 1 in 8, 1 in 4 scenario.
All right, okay. So in terms of, in terms of the prostate itself, who has the prostate? Which groups of people?
Yes, interesting. Who has a prostate? We used to say men and leave it at that. That it's only men that has can have a prostate cancer. But because our society is changing, there are other groups of people that also could suffer from prostate cancer. And when you see the list, you may be surprised to get your head around it if one of these people from this group were to be suffering with prostate cancer. So we know that men, all men, as long as you have a prostate, you can get prostate cancer. But the other groups are a trans woman. They can also have prostate cancer because when they have their reconstruction surgery, the prostate is not removed. And as long as the prostate is intact, you can have prostate problems. Another group is the non-binary people. Okay, they can also have prostate cancer. As long as the gland is not removed, you can still have. And then the last group is same intersex people. Again, they may have both genitals, but they may decide that they're either male or female. Again, if the prostate is intact, you can also have prostate problems with the prostate.
Okay. All right. Thank you very much. But what exactly is a prostate, Brother Hughes?
Oh, yes. The prostate is a gland. Okay. Prostate is a gland, and its usual size, they say it's the size of a walnut, shape and size of a walnut. And it grows bigger as we grow older in age. So that's the prostate gland. We'll learn what the function of it is a little later.
All right. Okay, then what are the signs? How do you know that you have a problem with your prostate?
So know your prostate. Firstly, what I would want to ask is where is it? It's amazing that when we do these talks live prior to COVID, the amount of men that don't know where the prostate is. Okay, so I'm hoping as you're listening, you have a sense of where the prostate is. So it sits just underneath the bladder, as you can see there. It sits just underneath the bladder. It has a tube that goes directly through it, which is called the urethra, which allows us to urinate or ejaculate. Now, the gland is a very intelligent device. It's just a muscle. It has two other attachments that goes to it, which are called seminal vessels. And the valve is a muscle, and it will, if you want to urinate, it will shut off those seminal vessels. If you want to ejaculate, it will shut off the bladder so that the sperm can pass through. So it's quite, as a muscle, it's quite intelligent and in terms of what it does. What does it do? What does it do? Well, the prostate is the main job is to help make semen, the fluid that carries semen. Okay, and then what can go wrong? There are three things that mainly goes wrong with the prostate. Firstly, you can have an enlarged prostate. Remember we said earlier on is that as you get older, the prostate will grow. Sometimes it grows at a different rate, but as it grows, remember say that as it grows, it can then begin to crimp the urethra. So imagine having a hose pipe in your hand, all right? And as the water is flowing, you start to squeeze that hose pipe. You'll find that the flow will slow down, but then you start to build up back pressure on the pipe. What then happens is that it builds pressure into the bladder, which can also cause stones. Okay, so that's an enlarged prostate. If you have an enlarged prostate, it doesn't mean that you have cancer. Okay, there are two different things. Second thing that can happen with the prostate is you can have what we call prostatitis. Now that can be an infection in the bladder or inflammation in the organ itself. And then the last thing that can happen is indeed that we may have prostate cancer. Okay, and we may explain a bit more about those as we go through, depending on the questions that you ask.
All right. Okay. So, what are our risks of getting prostate cancer?
Before we do the risk, let's just take a step back and look at the signs and symptoms. So, what happens when whether or not we have an enlarged prostate, which is caused crimping the urethra? We may find that we may have difficulty when we go to the toilet, that we may go to the toilet and we may stand there for some time before we're able to urinate. The converse is also true, is that every time we want to go to the toilet, it becomes an emergency. Can't get there quick enough. Again, those are some of the things that can happen. Sometimes you can find blood in your urine. That can be an indicator that something that is wrong with the prostate. So yeah, it's normally urinary problems that become signs. Interesting. And if you take nothing away from this presentation, please take this with you. Most men with early prostate cancer have no symptoms. Most men with early prostate cancer have no symptoms. And I'll come back to this when I make reference to some tests later on. Okay.
Okay, so what are the risks?
Okay, know your risk. So already we know that if you're a man, you're at risk. Okay. If you're indigenous, if you're white male, then your risk is 1 in 8. If you're a black male, your risk is 1 in 4. Okay. And then age. Your age puts you at risk. So again, for white male, 50 plus, you need to be having a conversation with your GP. For a black male, 45 plus, you need to be having a discussion with your GP. So family history, very important that you know your family history. Excuse me. And the reason for that is that if your brother and your father has had prostate cancer, your risk increased 2.5 by 2.5. Okay. If your mother and your sister was diagnosed with prostate cancer before the age of 60, it also increases your risk. And that's why it's important that we talk and have an understanding of what's happening with the family. I'm just going to tell you a story before we move on. I think it's a sad story. 2 brothers, brothers A and brothers B. So brother A, brother B is the younger brother, and brother A is the older one. So brother B began to have some symptoms and decided that he wants to go and have those symptoms checked. It came back from his results after he's had his PSA test and biopsies and so forth and so on, that he had prostate cancer. Being a dutiful brother and a loving brother, knowing that if he has that prostate cancer, the likelihood is that his brother also would have prostate cancer. So he went to speak to his older brother, and only for his older brother to say to him, "Oh, I was diagnosed 18 months ago with prostate cancer." Now, if the older brother had spoken to the younger brother 18 months ago, not saying that he wouldn't have had cancer, but he would have been caught much earlier, and therefore would be giving his younger brother a better quality of life. So those are some of the risks that we have.
Okay, that's interesting. So what do we need to do? What are our rights?
What are your rights? We do have some rights. We know already that if you're white male, 50 plus, you have the right to go and have this chat with your GP. Let this GP gives you the pros and cons of whatever examination he may or she may need to do. Sadly, we are getting some message back about the PSA test. The PSA test is just giving blood. You know, when you go and you give blood, they just take some blood from you, they send it to the lab, and they will launch the lab technician to check for whether or not what your PSA level is. Now, PSA is prostate specific antigen. Okay, that's what the prostate also produces. And then it flows out into your bloodstream, and hence they can look at your blood and determine how much of that antigen is in your bloodstream. Now, again, if you're a Black person, you need to, at 45, you need to be having that discussion. Now, these are just guided figures. We are seeing people in their 30s with prostate cancer. So don't believe that I've got to wait until I'm 50, I've got to wait until I'm 45 before I begin to have those discussions with your GP. All right, so what I would say here is to make sure that you have a PSA test done. It's just a blood test, all right? Just a blood test. They tell me it costs probably about £10, if that. So you're not going to break the surgery by having this PSA test done. So the only pain that will come from that is when they prick you with the needle. That's the only pain that will come from that. And what they do then test for is the level of this antigen in your bloodstream. If it comes back normal range, good. If it's a bit higher, they may need to do some more investigation, and maybe I can speak a bit about that later on. So know your risk. Sorry, know your rights even. You do have rights. Don't let, what I say to men is that don't take no for an answer when you go to your GP asking for a PSA test. If you remember what we read earlier on, that for most men with early prostate cancer, there are no symptoms. Now, a lot of GP are saying to men, well, they don't have any symptoms. What I say to men is give that back to the GP. That with early prostate cancer, there are no known symptoms. That's your rights.
Okay. So could you just summarize again, what action do we need to take?
Actions that we need to take. We have already identified some of those actions that we need to take. So first of all, we need to be having a conversation with your GP or your practice nurse. You need to be having that conversation. It doesn't cost you, what, 5 minutes to have that blood test done. They'll get that result back to you within a couple of weeks, sometimes even within a week. All right, so don't be afraid to have a chat with your GP. Now you need to be speaking with your father, brother, uncle, cousin, your whole family. Sometimes we tend to be secretive about these illnesses. It doesn't help because you're not helping the other people that can support you, or you could help them by identifying their cancer earlier. But what we say is, this is about raising awareness. And what we say is that awareness equals early diagnosis, and early diagnosis equal survival. Okay, early diagnosis equal survival. So the earlier you can, with any cancer, the earlier you can detect the cancer, the better your chance of recovery. And then if you're having problems getting a PSA test from your GP, what we suggest that you do that you call our specialist nurse on this number, and they will guide you how to get around that. But then you could have a second opinion, or you could even change your GP if that's the case. But you can get advice from caller or specialist nurse. That's what they do, and they can advise you with that.
Okay. you've talked a lot about PSA, but what other tests are there which are done?
Okay, when you go to your GP, if you're having problems, if you're going to find that you're going to the toilet more frequently at night or even during the day, okay, that may be a sign that something is happening with either the bladder or the prostate. Okay, so you go to your GP, and one of the first things that they may do is to do a urine test. Now, the urine test will try to identify whether or not you have any infection or inflammation. If it comes back that the urine test is fine, so they can rule out infection and inflammation, they may then go to what we call the PSA test. Remember, it's just a blood test, and they'll be looking for the level of the antigen, PSA antigen, in that blood. Some men find this degrading the DRE, the digital recta examination. So the GP will put a finger up your gum. What they're doing is trying to feel the surface of the gland, and also see whether or not they can determine whether or not it's oversized. If they find any abnormalities, they will then tend to send you for an ultrasound, or these days they will send you for a scan, an MRI scan. The detail now that they're getting from these images are excellent, and it cuts out some of the previous tests that they would do. If they're still not sure, they can use the scan to guide them to do biopsies. So biopsies are taken with a needle. And so the only pain that you'll feel is every time they take the biopsy till they get the pinprick. Can be a bit uncomfortable. But these are some of the early tests that you would have with prostate issues.
Okay, yeah, I think we can move on to treatments. I think you've prompted it there.
Okay, so the treatments would be, when you do your biopsy, you would come back with a score, a Gleason, what they call a Gleason score. All right. So if your score came back with, say, 3.3, which equals 6, which means then your Gleason score would be 6. That's grade 1. So that cancer, if you have cancer, that would be grade 1. Okay. Depending on the Gleason score will determine the type of treatment you may need to have. Okay. So you can have surgery, call it radical prostatectomy, to remove the gland altogether. But sometimes that is not done unless the cancer is breaking away from the gland. Okay, so then they want to remove the gland so that it doesn't spread anymore. Radiation therapy, again, it depends on hormone therapy, chemotherapy, which you may have heard of, immunotherapy, targeted drug therapy, and alternative medicine. But like I say, your consultant, based on your Gleason score, will then talk to you about your option or your treatment options, okay? So you can have a discussion with them about that. What are the disadvantages of each of the treatment? And I guess with them together, you may decide which treatment you may try, okay? Now, for somebody, for argument's sake, if somebody was to have a Gleason 6 score, which is grade 1, what they tend to do is not to treat it. They put you on what they call active surveillance. So every 3 months, they would take a PSA test to see whether or not the PSA is remaining the same, rising or falling. If it's continuing to rise, it may mean that they may have to rethink how they manage that. So with that stage 1, they just keep an eye on you. There are no treatment per se at that stage. I hope that helps in terms of the type of treatments that you could have.
Yeah, that's fine. Do you want to say something about more about the Gleason score? Because
yeah, I can just show you how they tend to score. Like I say, in the top one here, Gleason score of 6. Normally they take biopsies from both sides of the gland, and so they would, if you come back as a 3 plus 3, that's 6. So that means the Gleason score is 1. Okay, you can see for yourself there that they don't do very much with that. So the cell looks normal, but it has a slow growth. And when they may say, well, this grows very slowly, so it may take a long time. So if it's not a rapid cancer, you can go a long time with plenty of healthy men with Gleason score that you wouldn't know that they have any problem. So with grade 2, again, it's like we have 3 plus 4 or 4 plus 3. Comes to 7, then again, that's another scale. And you really then begin to get into treatment mode when you start to do grade 3. Grade 4, grade 5 is sometimes almost terminal. So you don't, you don't want to hear that you have a grade 4 or grade 5 cancer. That's the Gleason score, and that's how they come to determine what the growth of the cancer, and then what treatment they would use for that. Okay, so thank you for your participation. I don't know what happened there. Thank you for your participation, and we will field any questions that you may have at the moment.
Thank you very much, Brother Leebert. If anyone's got questions, could you please type them in the chat? There are already a few in there. Maybe we can start with that. I think we had, I think you faced this question many times, Brother Hughes. The question of the prevalence of this cancer in Black people. Why is it that it's more common, tends to be more common in Blacks than Caucasians, especially in the United Kingdom?
So I guess that's worldwide, but because I'm only giving you stats for this country. It's a good question. It's $1 million question. It's $1 million question because we don't truly know well. We know that lifestyle and diet is a contributor, could be a contributor, but it doesn't seem to be the main contributor. We look at men migrating from one part of the world to another, which may often means that their lifestyle will change or their diet will change, but we're not seeing the numbers reflecting in the same way. So we tend to think that there's something else that is the main contributor to this. We think it's maybe genetics, but there's no proof for that. Prostate Cancer UK at the moment is putting some funding and work into specifically that, trying to find out why is there such a difference in the range for white and Black men. I was surprised. As a matter of fact, they are doing some trials to do that. Unfortunately, Black men are not taking up the positions in the trials to do that. So it's a continuing struggle to get done. But yes, an interesting questions, and no, we don't have a definitive answer to it at the moment.
All right, thank you very much. Another question in the chat says, is frequent urinating a sign of prostate?
No.
Yes.
it could be that there's a problem with the bladder.
Okay.
But again, it's a starting point. So, like I say, your GP may do a urine test first, just to make sure that there's no inflammation. If there are no inflammation, then they may go to other tests and move up the grade, if you will, as they need to do. So no, because you have a unit issue, could be just the bladder. But
All
it's
right.
worth having it checked.
Yeah, sure. Okay. Another question following on from that says, can one with a prostate, I'm assuming they mean prostate cancer, lead a normal life?
Like I said, with any cancer, if it's caught early,
Yeah.
the chances of survival is in the 90s. Okay, so if you were to be caught with, say, a grade 1 cancer, your lifespan, could go on for some time. With the right, because like I say, they monitor you, and if things change, and they will change the way of managing it accordingly.
Okay.
But yes, you can have a healthy life. If you have an enlarged prostate, which is crimping the urethra, you may have to have an operation which would help you to pass urine more frequent, regularly. Okay, so because, like I say, sometimes you may go to the toilet. I remember 10, 11 years ago, I was having issues with my prostate, enlarged prostate, and I dare not pass a service station. Okay? I dare not pass a service station because there's always this urgency to go. 11 years on, now I've been diagnosed with grade 1 prostate cancer. So, we have to look after ourselves in the best way that we can. We have to have these conversations with each other, because us as men, what we tend to do when we meet, we talk about football, we talk about cricket, we talk about women, we may talk about sex, but we never talk about our health. All right? And so this type of programs is to help us to begin to start to have those conversations.
Okay. All right. Thank you very much. Another question, I think 2 people have asked this question. Are there any lifestyle changes which can be done or can be adopted to reduce our sort of risk of getting prostate cancer?
Lifestyle, with any illness, lifestyle practices are helpful. I see some things, let me just make this plain. I see some things on the internet with people that are making claims that they are curing the disease. Okay? We can try and make the patient as comfortable as they can. We can try and sometimes even slow the process down, but it's never a cure. Okay? So we need to be careful of what we read and who we listen to. But yes, lifestyle, good lifestyle practices, making sure you're not overweight, you're not obese, making sure you get enough exercise, making sure you get enough sleep, making sure you have a good diet. The 8 laws, as we know them, is always going to help you because it helps the immune system, and the stronger the immune system is, the more likely for you to fight off diseases. But they are not cures. Some people will talk about enlarged prostate. There are things you can do that will help to reduce or slow down the growth of the prostate, but it's not a cure. And again, remember, an enlarged prostate is not cancerous. So all you're doing is trying to make sure you can. I do follow a program to this, which is called "What Can I Eat?" But maybe sometime down the road we can have a look at that as well. But yes, better your lifestyle are or is, the more you're giving the body a chance to stave off some of our diseases. Hope that answers your question.
Yeah, okay, right. If you don't mind, if we go back to the earlier question of can someone with a prostate live a normal life? I think the viewers or participants have sort of explained further. When they say normal life, they mean normal sexual activity. That's what the question is saying. That
again, it depends on your treatment. Well, we already know that any treatment that we have will have some side effects. And again, that's why you would sit with your consultant and you look at the advantages and disadvantages of the treatment that they may suggest. You don't have to have them, but you may go along with it. Sexually, depending on the type of treatment you have, if you have the radical prostatectomy, which means they remove the prostate, that's going to have some impact on your sexual function. It's also may have some issues around incontinence. But again, your GP, naturally your GP yourself, your specialist would talk you through some of these. And it's good to have some questions when you're going. Don't go empty-handed. Go with some question. And again, what I would say, never go for a result on your own. Because sometimes your consultant may be saying something to you and you're not hearing at all. Or you may just pick up on one word. You may just pick up on the word cancer and you don't hear anything else. Try and take somebody with you that can hear more than you would hear. And maybe ask questions that you might not be thinking about, because you may go in a state of shock when you get the result. So yes, you can have it based on what has to be done in terms of treatment for the cancer may have an impact on your sexual function.
All right. Okay. Another question here says, can one live a long life after they've had prostate cancer?
Yes, like I said to you, if it's caught early, the percentage is in the 90s. It's caught early.
Okay.
That's why it's so important that we don't wait until it's gone so bad that when you go to the GP, or they can say to you, I'm sorry, Mr. Alfred, but you've got stage 4 or 5 cancer.
Okay. Right. Got an interesting question here. It says, does masturbation increase my risk of prostate cancer?
I don't know that there's any evidence to prove that or disprove it. I don't know that, so I can't give you a definitive answer. But I guess from a Christian point of view, we know that masturbation is not something we should be engaging in.
All right. Okay. Thank you. And then another question says, how fast does the prostate cancer progress?
Again, that is based on the growth of the cells. Dr. Alfred may know a little bit more than that, but what tends to happen is that the cells tend to grow abnormally, and sometimes they get a fast multiplication of the cells would mean that you may have a shorter lifespan. A slower multiplication of the cells may increase, it does mean that you'll have a longer lifespan.
Okay. And in terms of looking at the risk factors, again, there's a question which is asking, does taking vitamin E and selenium, is it protective against prostate cancer?
We've not heard that it is. I'm not saying that it may, from a health point of view, that it may not increase in terms of lifestyle and diet, that it may not increase our health. And if it increases our health, then it may just help to slow things down in general. I'm not going to lie to you. I don't have any evidence or know that this is the case.
All right. Okay. And there's another question here, which is also interesting. We know that there's screening programs for various cancers like breast cancer, cervical cancer. But why do we not have a screening program for prostate cancer?
That is a very good question. And that is part of the work that is being done with both government and also the NHS. You know, well, the women that are on here know that once you get to a certain age, you're automatically called in for certain tests. There's none of that for men. And so the work that part of the work that prostate cancer is trying to do is to at least get the PSA as a standard test. So you hit a certain age and you'll be automatically called in, all right? What we say to men also is that if you're of a certain age, you need to treat your prostate as if, well, the same way you treat your car in terms of every year you take your car in for MOT. So treat it as an MOT. And again, don't take no from your GP. If you're at a certain age or if you're experiencing some of the things that we'll talk about, your right is to have that test.
Okay. So it's interesting. You're saying we shouldn't take no from a GP. So it looks like, whereas in the other cancer groups, there's not that need because they've already got a program running. Mm-hmm. So I still don't sort of understand why we don't have this program. Sorry?
We still have a long way to go in terms of getting some of the statutory things in place that would mean that, you know, it's an automatic response.
Okay. All right, but glad that someone is working on that. Fine. There's another question here. Says, what other additional health issues is one likely to live with when they have prostate cancer?
Well, we already talked about the fact is that, okay, depending on your treatment and what needs to be done with your cancer, it may means that you would lose your libido. You may not be able to have sex intercourse, or that may have to change in the way that is done. If there may be that you may become incontinent, and then then there are ways to deal with the incontinent. And I guess it's if you have advanced stage cancer, then there'll be a lot of pain that comes with that, even with the treatment. You may be, how you respond to the treatment also can impact on how you function daily.
Okay. There's another question here. Says, what about riding motorbikes and bicycles? Do these have any risk to your development of cancer, prostate cancer?
There's no evidence to show that at the moment, but what we do say to people that may be going to have their PSA test done is to make sure that indeed you're not riding a bike, indeed that you're not doing heavy exercises, indeed that you do not have intercourse, indeed if you go to GP, your GP, if they do a DRE, shouldn't take your PSA at that point, because by doing that, examination is also agitate the gland, which means it produces, it raises the PSA level. So those are some of the things we say to people: if you're about to go and have a test, make sure you're not doing any of those things, because it will cause your PSA to rise. And that's why good GPs will do a test this week, and then they may repeat it next week or the week after, just to make sure that it's stable. Well, I say stable, that is not being elevated by some of these activities.
Okay. So one more question here says, previously when you showed when you're talking about the incidences among the ethnic groups, why is this low? Why is prostate cancer low among Asians?
Again, we think it's partly to do with the lifestyle. Yeah, it's partly to do with the lifestyle, but it's whether or not what we're trying to do is to get a comparison between, say, men in India, Pakistan, to do a direct correlation to those men that are from those areas what are living here, to see whether or not how we would extrapolate. Is that the right word?
Yeah.
Yeah. So on the face of it, we think it's down to the diet and the lifestyle.
All right. Okay. So one more says, does drinking alcohol increase the risk of prostate cancer?
We know that alcohol, I don't know about, I can just talk about cancer per se, as opposed to specifically to prostate cancer. We know that alcohol can contribute, and well, that's what the research is saying, that can contribute to ill health at any time. Not only, and again, what it does to the mind. But I can't give any specific regarding prostate cancer per se. If you can do without it, all the better.
Okay. Yeah, sure. All right. Yeah, thank you very much. I don't think I've got any more questions from the chat. You've answered all of them. Thank you very much for your time this evening and giving us this talk about prostate cancer and what we need to know, both men and women. I just hand you over to Pastor now.
Thank you, Dr. Alfred, and we'd like to thank Leebert Hughes as well, taking us through in detailed way from the very start, answering to all our questions related to this particular subject. Some of us who are in our early 50s, it's a high time for us to be active and really take charge and see whether we could speak to our GPs as soon as possible. And we'd like to thank all those participants who came today and joined the meeting, this evening session. And we are looking forward to meet you next week as well. I'm just trying to bring to your attention the next week, Monday, 7th of June, we are going to deal a topic called how do I handle my debt and fix my finance? This will be presented by Jumo, who's a financial accounting specialist, and Brenda will be asking questions. She's on the same field as well. During this pandemic, a lot of individuals are going through financial crisis, and you don't know what